What's up, you guys? This is your boy Miguel here to give you your daily dose of radiation. In today's video, we are covering the emergency room protocol if a bone is broken. So to give you context, I'm a night shift Xray tech. Been doing it for I could say over 4 years now. And so if you see something broken, obviously we as technologists can't say anything to the patient. We just take the images. Now, depending on your hospital, depending on the doctors and all that, there's been times where it would be a sense of urgency to go get the emergency room doctor or whoever's the doctor, because, like, let's say the hip is out of place, or the femur is shattered, or there's something like super major going on with the patient that would like hinder them, or it could like change their treatment or even movement or whatever they got going on, right? So I've learned over times that even most doctors already kind of know if something's already broken based off of just the simple how the leg's sitting, how the arm's sitting. You just kind of see stuff over and over. You kind of get a glimpse of an idea if something's broken or not. So they kind of already know, but sometimes it's a surprise. So I would highly recommend, just off of experiences, and can't confirm nor deny certain day shift activities that's happened where we've gotten in trouble because we haven't said anything. We just took it and we just kind of kept it going because we were busy or whatever we had going on. So I've learned quickly within like 3 months of working at my establishment that if you see something major, go talk to someone. And it also give better patient care for so they can help them better. But mostly it's hips we see a lot. They want to know right away, or sometimes for like shoulder displacements. So depending if they gotta like put them down to pop it back in or not, the timeline can vary. I've seen from like they'll do it right away, and then sometimes if they got to put them down, it could take like between 30 an hour, even 2 hours, just to get everything settled or situated, just to get them in the emergency, like in the trauma room, and get them set up with the people to put them to sleep, and just like pop his stuff back or their stuff back. But I mean, overnight, most of the times it's pretty chill. That's why I like it. Even the doctors are pretty chill. It's easier to communicate if you see anything. I know that if you see a pneumothorax, which is not really bones or anything, pneumo is something else. That one's a big one, because if you see a pretty big one, or even any in general, I would highly recommend reaching out to a doctor too, because those can leave people in severe cases, lead to death. And with the pneumothorax, literally their time is very vital, and it can be saved real quick with like a chest tube, or depending on what else they have going on, they can kind of monitor the patient and kind of save them. But there's been times where some of our techs maybe missed the pneumo or didn't see it, or we were too busy, couldn't tell anyone, and then it kind of became a big situation where they're like, did you tell anyone? And they're like, we didn't. Why didn't you? Da, 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 da. And then it just became very, very nasty. Even though at the end of the day, you are just a technologist, and you're just taking the pictures, and that's all you're supposed to do. But certain cases, to help, with the patients, I would highly recommend going to reach out to anyone. And I mean, as a student, I know, or even if you're new to the field, it gets pretty intimidating because you don't know stuff. All this stuff was very intimidating for me, because I was, as a student, or even just like a fresh tech, I was always like, so where's the fine line between stepping in and just pushing the button, or just like, how do I know? And literally, it just comes with time. With time, with experience, with seeing stuff, with learning stuff from other techs, from just observing as a student. Like, you acquire so much knowledge. And now, at the point where I'm at, I can go to work, and there's almost nothing that can really surprise me as far as like I've seen a lot of stuff even at work, so I'm pretty well versed on like how to deal with stuff. I mean, there's other stuff that I hope it never happens, but I've heard other techs, some of the more veteran techs, tell us about it, and it's good to know just in case it happens. So, but if you're new to the channel, I hope you enjoy these series. We'll be in 4K and we'll educate you in the world of radiology. We'll see you on the next one.